Are you tired of hearing that your kid is a fussy eater, that they're just trying to get attention, or perhaps they'll grow out of it? As a parent, feeding our babies is one of our first responsibilities, and as they grow older, we all feel better knowing they are fed and watered. So what happens if they start to restrict their food and mealtimes become far from enjoyable and increasingly distressing? Today, we're going to be talking about ARFID, Avoidant Restrictive Food Intake Disorder. And to help us understand this better, I have two guests joining me. Mum of two, Michelle Jacques, who has openly shared her lived experience of living with ARFID, and children's occupational therapist, Teresa Foley. Teresa is the founder of The Feeding Therapist, supporting families navigating complex and often misunderstood feeding difficulties, including ARFID and paediatric feeding disorder. Both Michelle and Teresa are on a mission to raise awareness, dispel myths, and offer more support. Welcome to the podcast, Michelle and Teresa. Michelle and Teresa, welcome to the podcast. Thank you so much for being here with me to talk about ARFID today. I thought we could start with you, Michelle, actually, just to tell us a little bit about your story and how ARFID has arrived in your life as a family.
So I've got two children. My eldest is 9 and my youngest, well, he's now 5. So when he kind of hit that weaning stage, being the second child, I kind of thought, well, I know what's coming. I know the stages. You read all the books. And then as soon as we started in like the lumps and bumps and textures, I was like, oh, this is not what happened before. Didn't think much of it. Me and my husband, remember to the day, we had a party for my daughter and we gave him like a bit of a lumpy food and he just spat it out, stuck it on his tongue, started going crazy. And I was like, oh, okay. So we kept trying, kept persevering. And I was just like, we can't get him past purees as such. Like we just couldn't get him any further. And bless him at the time, like all the sensory issues started. So we couldn't wash his hair, couldn't potty train him because he absolutely hated fabrics and textures. And I was a bit like, okay. In my head, I was like, I wonder if you're autistic. Everyone around me was a bit like, he can't be. And I was like, well, his eating's not okay. Like everything just started to become really, really apparent to me as his mum being there all the time. And then gradually as time went on, he had a very beige diet. So lived off of biscuits, crisps, all the things that was just easy to melt. But he never ate them properly. He never chewed them properly. He kind of sucked them till they would swallow. Mm-hmm. And I always wondered, like, has he got swallowing issues or feeding issues, anything like that? And then he was quite poorly when he was born. So he luckily was under a paediatrician already. And I said about his eating. And then at his healthcare check, it picked it up then. And eventually we saw a dietitian and things. And they mentioned ARFID. And at first I was like, what's that? What is this thing you're telling me about? And at this point, he had about 7 or 8 foods, was just living off them. Mini jammy Dodgers. He would have like 8 packets a day. I was like, you can look like a biscuit soon. But December 2022, he had tonsillitis and unfortunately ate a wafer that he would eat however many a day. He blamed that wafer for the pain in his throat and stopped eating. Okay. And he at that point, just dropped to yoghurt and he was drinking milk. So I was like, okay, we've now plummeted. And I was like, you've now hit the trauma aversion side of ARFID. That lasted for 18 months. He just lived off yoghurt, which was really tough. Like, going out for days, I was taking cool bags, I was taking freezer packs, I was taking mini fridges wherever he went because transporting yoghurt's not that easy, is it? Trying to go anywhere, we know we couldn't just buy it in a shop. I had to kind of forward plan. And then bless his soul, he had his appendix out last July, which at the time, I'd always said to my mum, if something like this happens, we are going to lose this yoghurt. And my mum was like, no, you'll be fine, you'll be fine. And we did. We lost it. We went straight down to milk. And I was just like, okay. Now we're in a really sticky situation. And I suppose with his ARFID, it's very medically based. It seems to be all his trauma is linked to like being poorly. So he then obviously only had milk, come out of hospital and he was discharged. And they did say, look, if he doesn't eat within 5 days, he's going to have an NG tube. And I was like, fine, okay, we'll work this out. But in a way that he allowed himself to drink these supplement shakes. So then at that point, he's drunk the supplement shakes ever since. But recently, after this whole fight, he literally within the last 2 weeks has started to eat. It's kind of his so medically backgrounded, as in he's so complex. You know, he's got that texture aversion, he's got that sensory aversion, but we can't get him any further because there's so much medical background to it. So yeah, he has unfortunately been referred for a feeding tube now, but actually since telling him, he wants to eat, which is strange because he's 5, you know, but you can see the fear in him. He's like, oh, okay, I'll try. And I'll give him that. He is trying, but it's the impact, you know, there's that, I'm sure Teresa will say, you know, the whole thing is don't pressure them. Low anxiety levels, don't pressure, don't push them. But in our case at the moment, really we have to in a way that we know the outcome's going to be the same. There's nowhere to go because he is literally down to nothing. He's just down to milk. So it's, it's a lot in the family.
Michelle, just going back to the initial, so for Arlo, there were obvious difficulties around food from a really young age.
Very young.
For your particular situation, it wasn't just one day that he decided that he just wasn't going to have food. It was obviously something that
just
he
from
was
the get-go,
from the beginning.
Yeah.
And when you were having these initial struggles, where were you emotionally of managing that? Because I think as a parent, the first thing you do is feed your child.
Yeah.
That's kind of your first responsibility.
Yeah.
So when they're not eating,
it's horrendous.
Yeah. So what did you do? How did you kind of...
Cried a lot.
Right.
Spent a lot of time just thinking, is this my fault? Like, what have I done? Did I not try hard enough? Did I not, you know, push him hard enough? You think of everything as a parent, isn't it? You know, was this me? And actually, so his eating must have been I started noticing it at 10 months old. I would only say I've accepted it is what it is, really, when he had his appendix out, which was only last year. Because I got to the point and I was just like, this isn't my fault. You can clearly see on paper, you can clearly see that none of this is done, anything that me or my husband or even his sister has done. Like, none of us have caused this. It's just the way it's been. And accepting it most probably is the best thing I ever did. But I have been through a lot emotionally and mentally. It's been really tough, like you say. It's trying to... You have children and you feed them, isn't it, you know? You come here, like today, do you want a tea or a coffee?
Yeah.
It doesn't just affect food, it affects drink. Everything is around that, you know. I can't take him to go and have a milkshake somewhere. Or it was those things that I found really hard. Even birthday parties for school, I was like, well, I can't take him. Or if I did, I was leaving before the food came out because I was like, I don't want him to be in that situation. But then I was kind of a bit like, well, actually, I'm segregating him from those situations. But it was more because I just couldn't bear it.
Yeah.
That everyone sits looking at you as if to say, like, well, why isn't your child eating?
That's what I was going to say. You know, I guess it's like a two-pronged thing because you're thinking about his need and what he's experiencing, having to be put in that situation, and then your experience as a parent
Of being judged.
Of the feeling of judgment. Did you have any... Did you ever have any judgment? Did you have it, or was there any noise around you about how you should be dealing with it?
All the time. You know, very, very, very early on, you know, when none of us fully really understood it. We all was just like, you know, he's got to eat. You have to eat. Why won't you eat? And we was all questioning it. No, I was, even before we knew what ARFID was. And that's okay. Because at that time, we didn't know what it was. You know, I hold my hands up. I most probably did try and force him to eat because I didn't know what I was doing. And there was most probably a lot of people out there who feel exactly the same. And that guilt eats you up alive. But the judgment's a whole new level. You know, we've been out for dinners before and I've sat stupidly on the end of a table next to other people and I can hear them. I could hear them discussing his eating.
Yeah.
And in the end, I said to my husband, I was like, we've got to leave. I can't take this anymore. I was like, why can't they just accept that everyone's different?
And do you think that was your drive for speaking out?
Yeah, 100%. I got to the point I just felt so lonely. I felt like I was the only person living it. I didn't know anyone else that was going through the same thing. And I thought, there's got to be someone else out there. And how I felt, I didn't want anyone else to feel alone. I didn't want anyone else to feel that I was going through it and not having someone that they could just talk to for 5 minutes or be able to relate with someone, isn't it? Just having someone understand that you're not going crazy or he does lick things now. He's kind of getting that sensory out or input from that. If I was to tell a friend that I've known for years, they'll think I'm crazy. But if I was to tell someone that's living with ARFID, they'll be screaming as loud as I am or crying, because it's huge.
Yeah.
It's a massive step, but not everyone gets that. And that's the hard thing. I think that's why raising awareness and advocating and just explaining it in more detail is so important.
I think that's where diagnosis, across the board, when we're talking, obviously specifically on this podcast about neurodivergent kids, where diagnosis can be so beneficial for families, parents, and obviously for the child, because it's a protection, and it is suddenly you're able to feel, okay, this is what's going on. And then you're able to almost take a breath and, right, what do I need to do? Yeah. But when you're in that complete tornado of feelings and trying to understand, was it something I did? Is it something that's happened? You're living in that just all-consuming tornado.
Yeah.
Obviously, I want to come to you now, Teresa, just for people that are listening who have never come across ARFID, because I have to say I hadn't come across ARFID, and that's, one of my biggest things with doing this podcast is to educate myself, educate others. As a parent of a neurodivergent child, food is a big topic.
Yeah, sure.
So could you explain to people listening who don't know about ARFID exactly what it is?
Absolutely. So Avoidant Restrictive Food Intake Disorder is the full title. It is technically an eating disorder. So it's kind of grouped in the same way that we have anorexia nervosa, bulimia nervosa. But it's really interesting because it's the only eating disorder that individuals who have this presentation are not actually restricting their food intake for the purpose of weight loss. So it's really important, I guess, for people to be aware of that when they hear the term eating disorder, it can sound a little bit alarming, a little bit scary, and they think, oh my goodness, my child's been diagnosed with an eating disorder. But it is its own set of diagnostic criteria. So typically, the kind of main criteria that we bear in mind when we're looking at ARFID are things like sensory hypersensitivity. So children or young people or adults who are presenting with very, very heightened sensitivity to the smell of food, the texture of food, the appearance of food. It can also be in relation to either fear of aversive consequences of eating or as a result of a traumatic incident with food. So something like a near choking episode or a near like a very severe vomiting incident. If a child's been very sick for maybe a prolonged period of time, and then they kind of have that horrible association with eating. And some children, interestingly, just don't feel hunger in the same way that the rest of us do. So they're the kind of three main subtypes, and you can actually have more than one presentation. So you might have sensory hypersensitivity combined with the lack of interest in eating, for example. Within those subtypes or categories, then we tend to see things like either weight loss, nutritional deficiency, or as Michelle so beautifully explained there, the whole what we call psychosocial impact. So ARFID is very much a fear-based diagnosis, an anxiety-based disorder. So you tend to see children who are just so anxious about the prospect of eating food that does not feel good for their body that before the food is ever even put in front of them, they're already anticipating, am I going to have to deal with food here that is too much for my sensory system to cope with? Am I going to have to put food in my mouth that I don't know how to chew or to move around my mouth or to swallow? And so regardless of the diagnosis in place, we all as individuals need both emotional security and sensory security to eat well. And so if you think about a little child like Arlo who's wondering, am I going to have to think about trying to eat something like a tomato that's going to feel really slimy and squishy and textured and bitty in my mouth? You can imagine the impact that that's having on him. Even the prospect of that would just make him so dysregulated, so anxious that quite possibly a child like that would maybe not even be able to be in the same room as certain foods.
Or run away.
Yeah, exactly.
So phobia.
Yeah, absolutely.
And just to be clear, any child or adult can be diagnosed with ARFID, but that there is, what's the percentage of neurodivergent children
So that's a great question. ARFID is still a very new diagnosis. So it was only first recognised in the literature in 2013. Yeah. So actually, we've only got 12 years of data on this condition. But obviously, it existed for a very long time before that. Mm-hmm. So I guess in terms of neurodivergent individuals, we're still gathering data on the prevalence. Some estimates would say that there's up to 50% overlap between individuals who are neurodivergent and have ARFID. It's at the same time you can be neurotypical and have ARFID. I like to kind of talk in the wider umbrella of neurodivergence about eating differences, because there are, if you think about autism and the entire neurodivergent umbrella as I see it in my head, we have data just this year to show that 89% of autistic individuals will experience eating differences at some point. And so that can be vastly different. It might just be someone who has a preference for, beige carbohydrates, but they still manage to eat all of their food groups very well. Or you can, at the other more complex end of things, have a presentation like Arlo's, where you see the child over the years possibly narrowing their food intake, narrowing their food groups, and at the same time, possibly the stress and anxiety and fear of food increasing at the same time.
So I had this strange experience this morning, and I was saying to Michelle that I keep meeting these people. I don't know whether it's, maybe I'm a bit weird with the universe, but it is weird. It's like when you think you're going to get a new car or something, and then that's the only car you see.
Yes.
Yeah.
Or I don't know, it just keeps coming up to me. And I was in the school office, and there was a lady there, and we were chatting. She was asking me what I was doing today. Actually, no, she didn't. I just said, I'm going to go and record this podcast. But I didn't give any details. And
okay.
I was explaining a little bit about it and raising awareness. And she said, well, my son, we don't have any kind of neurodivergent diagnosis, but we do have food difficulties.
Yes.
And she said he just woke up one day when he was 3 years old and just stopped eating.
Oh, no.
And he's 17 now.
Okay.
And he messaged her, she said, just a few weeks back, saying, Mum, I think it's ARFID, and it's now become clear. And she was explaining to me how now as slightly older, he's able to help himself
yes.
a little more. So if they cook a curry, for example, he'll wash off the sauce from the chicken.
Yeah.
And he'll have that. But it was just unbelievable that I would speak to that person who, what are the chances? Yeah. But I think, just going back to talking about ARFID, if you're listening to this, I do think there would be lots of parents, including myself, who have had difficulties with their children and food. And people might say they're being fussy, they're being picky. How do you differentiate between ARFID and, food differences, as you were saying? If you're listening and you're thinking, oh, some of this sounds familiar, how do you know where you sit?
It's a great question and a really complex one, because oftentimes we don't arrive at a diagnosis like ARFID overnight. It can take lots of careful assessment by feeding therapists and clinicians. One of the things that I look at as a feeding therapist and occupational therapist is the impact on the child's quality of life and what I call the functional impact for the whole family. And so, again, Michelle has captured this so beautifully in the way that she gave the example of, the family can't just pop out for, a milkshake or a burger or whatever it is. It is such a job for the family to go, because all of the preferred foods have to be packed in advance. Again, if, thinking about the child's psychosocial function that we talk about, if there's a massive anxiety there, if that anxiety is preventing the child doing things like going to birthday parties or after school activities, or even lots of the children who are on my caseload cannot eat in school because their sensory sensitivities are so overwhelming that they cannot cope with the sensory environment of the school dining hall. And so as a result, they are unable to eat for the entire school day. By the end of the day, they're so dysregulated, so overwhelmed that they go home, often have an emotional outburst or episode because they are so hungry, so overwhelmed, so starved. And so their whole day then is massively derailed by these eating differences. So parents often say to me, when should I worry? And I think there is this kind of belief out there that if a child is within a normal weight or if their BMI is normal, then they can't have ARFID. But that's something that I feel so strongly about. That is such a myth. You can have a very healthy or normal or typical BMI, your growth can be tracking perfectly, and you can still have a massive fear or anxiety around eating. So there's lots of different factors at play and there's lots of different indicators, and again, that is why where it's possible, trying to link with feeding services if they are available because as clinicians, we take a lot of time to go back to the very early feeding history, because oftentimes there are clues there for us from the get-go. And that information can be so vital then for us in terms of forming that picture. But sorry, so that's not giving you a very black and white answer there. But it's probably talking about the complexity of the situation.
What's your thoughts around early intervention?
Absolutely crucial. Sometimes if you take your baby or toddler or whatever to the health visitor or the GP, and there is this kind of thing of let's just watch and wait. For me, feeding is the one area where I do not advocate watchful waiting. The amount of parents who've spoken to me over the years about, been told it's just picky eating, see how you go, just keep exposing them to different foods, it'll pass. And parents are saying, I knew it wasn't going to pass, I just knew it was getting worse. But we have really nice evidence now to show that if we can get in there in the very early stages, so I'm talking the toddler years, the preschool years, and possibly work with the child and the parents, because all feeding is done within a relationship. And if we can maybe even just get in there early enough to address some of those sensory sensitivities, for example, that we can maybe just reduce some of the negative associations with eating, that can be very impactful and very powerful in helping the child to go on and have maybe a little bit more positive of a relationship with food.
So what would you do?
So lots of targeted specialist intervention, occupational therapy, speech and language therapy. And this is the ideal, I'm always going to talk about the ideal. I'm fully aware that day to day, lots of families are not able to access any feeding services. But this is, I must say that we always are striving towards multidisciplinary input. I guess on a day-to-day basis in the home, what I love to see families do is to focus first of all on creating a connection around a positive connection, a positive engagement around eating and mealtimes. And I'm using the term mealtimes lightly because for a lot of these families, family mealtimes around the dinner table, they're just not possible. But that's
what
fine.
Are those?
Yeah. What's a dining table?
Exactly. But that's okay. And all I ever encourage families to do is just meet the child where they're at the moment. So if you have a child who right now, their preferred way to eat is to sit on the sofa, wearing their ear defenders, watching their iPad, eating a bag of crisps, that's okay because that right now is how they eat best. So I just say to parents, can you join them in that moment? Can you sit beside them? Is it possible for you to share those crisps with them? How can you find that connection? And how can you engage in that co-regulation with the child? So we just meet the child where they're at and then we go from there. Does that make sense?
Absolutely.
Yeah.
And I think, in so many of the challenges you face being a parent of a neurodivergent child is this idea of forcing them to do something. And I find that pressure quite enormous, and not just externally, but also in my head, because you so want them to be able to. And you have to learn this entirely new language and skill about how to collaborate with each other and work together to get there as a team rather than, a hierarchical figure coming in and forcing them to do something. And I also think what I'm learning a lot about is actually we really want them to be able to advocate for themselves and learn to communicate what it is they're feeling. So I'm very conscious of you don't want to shut down that conversation which I think can happen pretty quickly if you're not given the tools in help of how to understand with the language and communication.
Yeah.
How much of that is involved with you when you're treating children with feeding differences?
I guess, first of all, I actually talk to parents and children about their own kind of feelings in the moment around feeding, because actually when you spoke earlier about kind of all of the emotions that come into play, you know, I always say feeding brings up tricky feelings on both sides, doesn't it? And, you know, well, I definitely grew up with a lot of messages around you eat all your dinner and you stay at the table until your plate is clean. And parents say to me, I still have that narrative going on in my head.
Well, to think my mum was made to eat the leftovers the following morning if she hadn't finished.
Oh,
you know. And so now she has this
then,
like real
it was
thing.
like, that's what they did, wasn't it? It was, you know, you can't get down from the table. You've got to eat. You're not having dessert. And it's,
exactly.
And then dessert becomes the good.
yeah, exactly.
You know, and
bribery definitely don't work.
Yeah, exactly.
No. So, like, to go back to your point, Izzy, you almost do need to learn a whole new set of rules and language. And for me, working with these little people who often are really scared of food, for me, a lot of it initially is about validation. And just simple phrases like, I can see this is really hard for you at the moment, and that's okay.